tonsil stones! Everyone is always asking me about tonsil stones, so let's talk. Hi, my name is Whitney and I'm a dental hygienist here to talk about how to prevent tonsil stones. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to join thousands who have already discovered all of the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. I made it just for you, for it can actually help you prevent tonsil stones by keeping up with your dental home care habits. And having said that, for today's video, let's talk about tonsil stone prevention. First of all, what are tonsil stones? A tonsil stone is a calcified buildup of debris that collects on and around your tonsils. They're made up of minerals, food debris, and oral bacteria. And if you're one of the small percentage of people who gets tonsil stones, you already know how annoying they can be. I'm one of them. I used to get them a lot, so I know. They can cause some serious bad breath, and they can also sometimes be super uncomfortable in the back of your throat. Now, here's the thing. Not all tonsil stones are visible. So if you have bad breath that seems to be coming from the back of your throat, take a look-see. You never know. Sometimes they are visible. And if they are, you'll usually notice a clump of white or yellow or even gray on your tonsil. It will generally look like a circular area or spot on your tonsil, and it's actually very similar to an iceberg because what you're seeing is only the tip, because the biggest part is typically hidden from plain view. I'm sure you've seen those tonsil stone removal videos. They're like icebergs. They just keep going and going and going. But if you cannot see them, the symptoms that might indicate that you have them are bad breath, sore throat, trouble swallowing, ear pain, ongoing cough, and swollen tonsils. And there are 4 things that make you more likely to get tonsil stones. 1, if you've had a health history of infections and illness, especially in your throat. The more throat infections you experience, the greater the risk of scarring, which raises your chances of getting tonsil stones wedged down in between all that scar tissue. Number 2, large tonsils. If you have large tonsils in general, maybe you weren't sick often or anything like that, but you just anatomically have large sized big tonsils, tonsil stones are more common in anyone who has big tonsils. Number 3, chronic sinus issues. Mucus drainage down in the back of your throat can irritate your tonsils and lead to bacterial accumulation around the tissues in the back of your mouth. Although tonsils are not inherently part of your nasal sinuses, they can become irritated and develop tonsil stones if you have constant post-nasal drip. And lastly, number 4, poor oral hygiene. If you're not great about brushing and flossing every single day, you're going to naturally have a higher number of bacteria inside of your mouth, which increases your risk of getting tonsil stones. Like I talked about at the start of this video, dental home care routines are critical in preventing so many dental issues, including tonsil stones. So if you struggle with habit forming, brushing, flossing daily, be sure to check out my oral care guide in the description box below. Now, no matter what caused them initially, if you've had tonsil stones once before, you are now more predisposed to getting them again. So for the purpose of this video, I want to focus on all of the ways to prevent them. I have another video that goes into detail about how to remove them, which I will link in the description box if you want to learn more. But you know, most of the prevention steps are actually the same as the removal steps, so it's worth listening to the rest of this video either way. And after you hear these prevention tips that I'm about to go over, if you want more, then go ahead and check out that other video of mine. So finally, 5 ways to prevent tonsil stones. Starting with number 1, practice good oral hygiene. It sounds so lame. Practice good oral hygiene, I know, but listen up. This is key. Like I mentioned earlier, poor oral hygiene is one of the leading causes of tonsil stones. Proper brushing and proper flossing leads to less bacteria in your mouth, and the less bacteria you have inside of your mouth, the lower the chances are that it's going to get lodged in and around your tonsils. So brush 2 times each day and floss and/or clean between your teeth at least once each day, the most optimal time being before bed. And hey, don't feel bad. Don't be hard on yourself about this, because even if you have amazing dental hygiene, you do all of the things, it is still possible to get tonsil stones. So we will talk about other things you can do, but I had to say this first because this is generally the number 1 thing to check off your list in tonsil stone prevention. So many people skip flossing before they go to sleep, and it really matters when trying to prevent tonsil stones due to, like I said, reducing the amount of bacteria in your mouth. Now, for number 2, tongue scraping. About 90% of bad breath bacteria specifically is found on your tongue. And by using a tongue scraper instead of just brushing your tongue with a toothbrush, you can reduce the amount of bacteria on your tongue, thus in your mouth, which leads to a less chance of getting tonsil stones. And once you get in the habit of using a tongue scraper, my oh my oh my, you will love it. I used to get tonsil stones all the time, really bad. And I did use a tongue scraper, but here's the thing. I didn't use it as well as I could have. I really had to train my tongue and my throat to allow me to go as far back as I can with the tongue scraper. Not until I did that did I stop getting tonsil stones or reduce the frequency of getting tonsil stones. So I used to get tonsil stones like every month, and now I might get them once a year, if that. And I really contribute less tonsil stones to using my tongue scraper to its maximum efficiency. I really get it as far back as I can. I will link my video on how to train your mouth into not gagging. So if this is something that you struggle with, be sure to check the video link below. And if you don't have a tongue scraper, you can always use a spoon, a metal spoon from your kitchen. It actually works pretty well. But just using a toothbrush isn't enough. You really need to scrape that bacteria off of your tongue. Okay, number 3, stop smoking. Tobacco use can alter the tissues inside of your mouth and raise your risk of tonsil stones, not to mention your risk of gum disease, cavities, and oral cancer. So really try your best to stop smoking if you smoke, and if you don't smoke, don't start. Number 4, gargling with non-alcoholic mouthwash, and number 5, they go hand in hand, gargling with salt water. Spoiler alert to the other video of mine, gargling with warm salt water is actually one of the best ways to dislodge tonsil stones and get rid of them. Gargling is one of the main recommendations for tonsil stone removal. So just like gargling can get rid of them, it can also prevent them. I gargle with warm water every single night, almost hot water honestly, but I will say warm because it is safer. You never want to burn your throat. But I don't even add salt for the prevention. I just do warm water, and it really has helped me prevent my tonsil stones in combination with the tongue scraper, of course. And if I ever feel like maybe one is starting to form, I'll immediately start adding salt to my nightly warm water gargle, and it nips it in the bud. It stops it from forming. Sometimes I will also use a non-alcoholic mouthwash if I want a little more taste to my gargling session. I will of course link products in the description box if you want to learn more, because if you're planning to gargle with mouthwash, you want to make sure it is both a non-alcoholic mouthwash and a non-acidic mouthwash. In all, if you're prone to getting tonsil stones and you just can't seem to keep up with them, none of these tips have helped you prevent them from forming, I highly recommend that you visit a dentist and/or ENT to have your tonsils checked. An ear, nose, throat doctor can evaluate your tonsils and recommend specifics for your individual situation. And until then, continue gently gargling with warm salt water or non-alcoholic, non-acidic mouthwash. Also be sure to stop smoking, start using a tongue scraper, and keep up with your home care routine of brushing and flossing every single day. Don't skip a night. Do not go to bed without brushing and flossing, because that will truly set you up to getting tonsil stones. And speaking of keeping up with your home care, if you're interested in creating the perfect routine to prevent tonsil stones as well as other dental issues such as cavities and gum disease and costly dental visits such as deep cleanings, fillings, crowns, to avoid all of that, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide and join thousands who have already discovered all of the essentials for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile, and I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website teethtalkgirl.com and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth, and no tonsil stones.